It is a crisis impacting millions of families from all walks of life, and President Trump unveiling his administration's plan to combat America's opioid epidemic.
Strong law enforcement is absolutely vital to having a drug-free society. And I'm confident that by working with our healthcare and law enforcement experts, we will fight this deadly epidemic, and the United States will win.
And here to weigh in is Dr. Nicole Saphier. Thank you so much for joining us again this morning.
Morning.
Always nice to have you here. So in terms of the prescriptions alone, let's begin there. And the amount of opioids that have been described and sold, or prescribed and sold in the U.S. Has quadrupled since 1999.
Yes, absolutely. A lot of that has to do with how we value our healthcare system. The United States functions very differently than the rest of the world. We have far majority of the opioids being in the United States. We put this imperceivable value on controlling patients' pain, where we're not, and so a lot of times you are not giving the physician time to talk about, like, how else can we treat your pain, and really having that conversation of risk and benefits with the patient.
That's what's interesting, because while the numbers of the prescriptions have quadrupled, the number of people complaining of pain has not. That's pretty much remained the same.
Absolutely true. And, you know, it's a cultural thing in a sense that Americans actually take prescription medications, pain medications for acute injuries, where you see in other countries it doesn't necessarily happen. Really what's going on, you know, you have to attack it from all sides. You can't just say one thing's going to fix this. As President Trump has mentioned, everyone's affected. You need to affect supply and demand. Right now you have overprescribing, overutilization of opiate medications, and this is causing a lot of patients to have, or a lot of people just to have access to opiates, whether it's, you know, for legitimate reasons or not. They're out in circulation, and that causes addiction.
Since they're already out there, we already know that the addiction numbers are skyrocketing, the amount of deaths are skyrocketing. What do you do since it's already out there?
Multi-pronged. What you have to do is you have to limit supply and demand. We already have this in place right now. Unfortunately, it's not going to happen overnight for everyone. Physicians are decreasing their prescribing. We're tightening up. We need a centralized regulatory monitoring system, so we know if a patient's getting a prescription from this doctor and a prescription from this. If a patient overdoses right now, their primary care doctor is not alerted that they actually had an overdose, and they may still be writing them prescriptions for their opiate medications. We need a little bit tighter regulation, not necessarily removing physicians' rights to practice.
Right.
However, we need to be monitoring. And President Trump said it absolutely right. We have a lot of illegal forms of opiates coming by land, sea, air. So we have to control it. We have to stop it from crossing our borders and land, coming from email.
So stop the flow entering the U.S. and then stop or lower the amount of opioids that are prescribed as well. Do you feel a little bit better that this president is stressing this? Because obviously it took a while to get to this point, and we haven't heard about it from other administrations. To this point. Unfortunately, what has happened is it's kind of slowly been growing. This didn't happen overnight. This has been going on now for decades, and here we are. And we're calling it a crisis. We're calling it an epidemic. And President Trump is right. He has to treat this as a crisis. Whether you want to get caught up in the rhetoric of declaring it an emergency or not, he's treating it with an intense seriousness, and I appreciate that. Any efforts to treat the addiction or to treat our patients is going to be thwarted if the supply and demand is not there. If they come out and it's just right in front of them and people keep giving it, their treatment is going to be And you're right. Regardless of the politics, the numbers are staggering. And since for the 12 months ending in September of 2016, nearly 60,000 Americans died from overdoses. That's the largest annual jump ever recorded. So we have to do something about it.
It's essentially a 9/11 attack every month.
Thank you so much for joining us, Dr. Saphier. Good point there.